Welcome back to Real Talk with Susan Stone and Kristina Supler. We're full-time moms and attorneys bringing our student defense legal practice to life with real, candid conversations. Today's topic is understanding normal child development from birth to college from the perspective of our guest speaker, Dr. Elizabeth Bukhari, affectionately known to us as our friend Zizzy. Welcome, Zizzy.
Hi, thank you so much for having me.
Zizzy, we're so pleased to have you with us today. For our listeners out there, Zizzy's been a pediatrician for the last 21 years at Senders Pediatrics. She's one smart cookie. She went to Princeton University and then Columbia College of Physicians and Surgeons. She completed her residency at Johns Hopkins. She has 2 grown children, and Susan and I have really had the pleasure of getting to know Zizzy better through a women's retreat weekend that we participated on at a camp in New Hampshire. It was a blast. And we spent time hiking and doing fun outdoor activities and got to know Zizzy better. So we're so pleased to have you join us today in your capacity as a pediatrician. Thanks for joining us.
Thank you for having me.
I'm going to start with an age group that I haven't had the privilege of being with now that my kids are old. It's birth through toddler, the toddler years, those cute little people. Can you tell us, it's so hard to know, and I hate using this word, but what is considered, and I'm quote unquote, normal childhood development from birth through the toddler years, and what are signs of what might be a developmental issue?
Sure. So like you said, you don't want to pin people too much into normal and abnormal. And I do think a lot of parents these days really look at these trackers and milestone sheets and get nervous sometimes if their kids aren't doing exactly what's said. So given that there's a big range of normal, there are some good guides you can go on, like the CDC has a milestone guide that you can go on. But basically, babies around 6 weeks of age start to do a little bit of a social smile back at you, which is very nice, and some cooing. And then around 6 months of age, they start to include some consonants like ba, ba, da, da, ga, ga. And then their language starts to sound like a foreign language that you can't understand. Like they say, abba, jabba, wabba, labba. But they're definitely telling you something. And it's cute. And then you can go back and forth and say, oh, really? I like that too. And then they chat back and forth with you. And then around a year, you start to get the sense that they understand you pretty well. So you could say something about their shoe and they look at their shoe, or the dog and they look at the dog. Or you say it's time to eat and they get excited.
So the receptive language needs to come in. Does it need to come in, or does come in before the expressive language?
Always the receptive language comes before the expressive. And also, if the receptive language is there, I have parents quiz their kids a little bit. If they're reading a book to the kid and they say, where's the doggy, or where's the tree, or, on their own body, where's your head, where's your tummy, where's your toes? Then they know those words. They know head, tummy, toes, even if they can't say the words. And if they know the words, then you don't have to worry so much if they're late talkers.
Before we move on, I just have a question, because I've heard a controversy about this. Crawling. Is it a milestone or not? Do you have to crawl before you walk, or can you skip it and scoot and then walk? Because I've been hearing that it actually is important for that child's brain development to have that cross-lateral motion.
Yeah, I think you're right that there is some controversy about it. And most kids do crawl before they walk. But there are I've definitely had some patients who do this thing I call the sit and scoot. And they sit and they do this funny thing with their legs and their knees and they get themselves around. A lot of times I think it's kids who have older siblings and they don't see the older siblings crawling, but they see the older siblings walking. So they are, and they don't see so they see the older kid sitting and they see the older kid walking, and they just kind of sit and zoom around, and then they are dying to stand up and walk. But I do think probably if you talk to a physical therapist, they would say what you said about it's important to have the cross-lateral motion, et cetera, et cetera. But the kids I've had who sit and scoot and stand and run seem to be doing fine. But most kids do crawl before. Yeah. So in terms of the gross motor development, they roll between 4 and 6 months, then sit on their own around 6 months. Then they get from sitting into the crawling position around 7 to 8 months and pulling to stand at 9 months. And then usually taking some independent steps between 12 months and 15 months. And then look out. Because then they're running and climbing and getting into everything.
Zizzy, one last question on this discussion of basically birth to early toddler developmental milestones. What about speech? At what age should your child articulate their first word?
Right. So that's usually between 12 and 15 months that they're saying it. And they call it sometimes a word approximation. So like they'll say, ba, that means bottle or bubble or baby or ball. But you see them looking at the ball and they say, ba. You're like, yes, that's your ball. And it is good to fill it out. As cute as this stuff is that they say, try to say the real word that they're trying to say, because then that'll help them say the real word. And then usually by 15 to 18 months, they start to really pile up the vocabulary. And that's right around when, like 15 to 18 months, if they're not hitting those milestones, there's usually a 15-month visit and an 18-month visit. The pediatrician, if there's any concerns that the child is not, first of all, understanding, because that's the most important thing, that they're not understanding language or they're not trying to communicate, then the pediatrician would probably recommend some more evaluation. And one good first step is something called Help Me Grow, which is a free service through the county that sends a team of people, usually one person to start, but to your house, and can do an assessment. And if the child needs any extra help, they can do speech therapy, physical therapy, occupational therapy. They're amazing.
Talk about what is normal play, because who said play is the work of a child? Is that the founder of the movement, right?
Yeah, I mean, that's their job, right? Their job is to play. And I do think that's important for parents to remember, because especially nowadays, everything is, am I giving my kid enough stimulation? Are they doing enough classes? Are they in enough things? Am I going to teach them their foreign language? But really, they just sort of need a Tupperware and a spoon and a paper towel tube, and they'd be happy. You know, you remember, like the example of, on the holidays when the kids are unwrapping the presents, they like the wrapping paper better than the presents half the time. So a lot of open-ended play. I am a big fan of things where the toy can be played with many different ways. My favorite present for a toddler is a set of blocks that are in multiple shapes, like the squares and rectangles and the triangles and circles. And there is some good studies to show that for girls, if they play with more blocks and puzzles, they're going to be better at math in the end, because it'll help them with sort of geometry down the road. And the kids can play with it very open-ended. Like I had 2 daughters, and they love to build houses for their stuffed animals with the blocks. And then we'd have boys over and they'd build ramps for cars with the blocks. And you can do a lot of different things with them, but you don't have to do what the package says, because they're open-ended.
What's abnormal play? Yeah, what would be a sign if you look at a child? Do you agree that if you see the child, let's say, lining the blocks up in a line, should you be freaking out and worried?
Yeah, that I would say no. That alone, a lot of kids like to line stuff up. Now, certainly there are some kids on the autistic spectrum that can get very into certain toys and having them in a certain way, but that wouldn't be like the major red flag. Usually it's a little bit more of, in terms of autism, that they're not understanding you, they're not wanting to communicate, there's poor eye contact. There's sort of more to it than that. And then they may have some like hand flapping motions, but that can also be in the neurotypical range too, like if kids get excited. So for autism, it's tricky, because there's a lot of things that can be normal or can be on the spectrum, and you have to kind of put the whole package together.
Zizzy, many of our clients are students on the spectrum of all different ages, and it's not unusual for students to come to us, well, families, I should say, and there's some challenges the students experiencing. And after some more digging and evaluation and meeting with various professionals, the child is diagnosed as having autism, being on the autism spectrum. So you've mentioned some red flags or signs or behaviors for parents to look for. Is there a certain age when this issue of autism should really be on the radar of parents, or a certain age when a child can really be evaluated for autism?
Yeah, I mean, I guess I would say 15 months I'll sometimes start to get a little wondering about it, but then I usually try to give them till 18 months to pull everything together. But around 18 months, if they're not pointing at things, if they're not understanding you, if they're not trying to communicate, then I would start the evaluation at that age, because number one, early intervention is huge and can really help a child out. And then unfortunately there's waiting lists for a lot of these things. If you have any concerns, it's much better to get referred to a development I usually start with a speech therapist, but then if there's more concerns, to get referred, we'll talk to your pediatrician, but then get referred to a developmental pediatrician. And that could sometimes take several months to get in. And I'd love to have that done by 2, so that then if the child was eligible for some early intervention preschool, there's, as you guys know, there's some finances involved in it. And so it's good to get that. I would say try to get it done, or at least started by 2. And then by 3 for sure, because that's a lot of times when the preschools start is at 3, and everything just takes time.
Everything
Great
takes
advice.
time. That's great
Yeah.
advice. Well, we're going to leave the baby years and get to elementary school, which I kind of consider the golden years of having children, because
Mhm.
I love
agree.
second graders. Christina and I this year got certified in positive discipline
Mhm.
because, frankly, we wanted to be able to talk to our clients, because we have a lot of meltdowns from students that we represent because they're under so much pressure. And we kind of want to focus early on what is considered normal acting out, though, versus early signs of ADD or oppositional defiant disorder.
Well, what I would say is in that 3 to 5 year age group, they talk about like 2-year-olds and temper tantrums. You sort of expect some temper tantrums from 2-year-olds, and even 3-year-olds are pretty. You may have heard of the term 3-nager. So 2-year-olds, they're not always able to communicate so well, but they do have their needs. And often if they're hungry and tired, they just completely fall on the ground crying. And one of your guests, I can't remember. I think it was the episode on positive discipline. They talked about how some of the main reasons why children misbehave are being hungry and tired. And I really do believe that's the case. So I am a big fan of getting them enough sleep, and then trying to make sure they're eating food with protein and fat. Because if they just eat their carbs, which they love, the fruit and the crackers and the noodles.
I love goldfish.
I'm just smiling because you're saying the main reason for misbehavior among children is being hungry and tired. And I think the same is probably true for adults as well. Of course,
Exactly.
excluding present company.
Yes, of course. Of course. I remember one time literally yelling, full volume yelling at my daughter. And I said, "You are acting like a child."
Just, no, Mom.
And then I just laughed because she actually was a child.
Oh, that's funny. And where do you see the signs of ADD and ODD? Because we deal with those issues, and when they become different issues.
Sure. Yeah. I mean, technically speaking, you're not even supposed to diagnose ADD until 6 years old, just from the criteria. But there definitely are families where the one parent has it, a sibling has it, and the kid is just running around the room, just tearing the place up, where you kind of know they're going down that path. But typically, I don't recommend diagnosing it till 6. But occupational therapy is actually the first step in helping children with ADHD, before you even get into medication. So I would definitely refer a kid who's in the 3 to 5 range, who cannot sit still and having a hard time paying attention, to occupational therapy as a first step towards either helping them mature and helping them get things together, or if not, a first step in kind of treatment. And then oppositional defiant disorder is probably a little out of my realm of diagnosis.
What about this
Yeah.
hypothetical? You have a family with a child who's 5 or 6. The family doesn't go to restaurants because the child restaurants, it's like sensory overload. For whatever reason, the child can't handle the restaurant. Struggle to have play dates. The child just doesn't listen. Boundaries. Parents just struggle to have boundaries. And parents sort of get to that breaking point where, oh my gosh, I'm at my wit's end. The mother or father, what do I do? My child doesn't listen. I have to make my child listen. I'm going to spank them because that's the only thing my child responds to. What is and of course, I recognize that spanking is controversial. I mean, do you have thoughts on that for discipline?
My parents deny it, but I was spanked.
Yeah.
They'll deny it, guys.
Although luckily, I do feel like that doesn't come up that much anymore. I do feel like people have just kind of started to realize that spanking just doesn't work because then the children will just start hitting either you or their siblings. But I just don't feel like in the last 10 years that has really come up that much. Or maybe people are just not admitting it. But I feel like that message has kind of gotten to people that hitting a child doesn't in the end make anything better besides the short term. They'll be scared.
Timeouts work either. I got to tell you, they did not. Today, when everybody has such a great bedroom, or just it never worked on my kids' timeout.
Yeah. Well,
or they sit on the stairs. Okay.
I tried to do it a little bit like for the young kids, the kids that are pre-verbal, like kind of in the 1 to 2 year range where they're hitting. I just try to do timeouts usually just for hitting and biting. The two big baddies, I call it like a sports analogy, like the flagrant foul. If they really are doing something.
That's good. That's an example.
Because, there's kind of like the noodling and the poking and the pestering. But like if they walk up to the brother and just whack them on the head, that has to be addressed. And I try to tell people that you just pick up the child. You say, don't use the word no because they love to say no. And you just say, hurts, or hitting hurts or biting hurts. You're having a timeout. You hold them in your lap, facing out, close your eyes and count to however many seconds they are old, 60 seconds for a year, 120 for 2 years. And that's it. And then it's done. There's no lecture. There's no sermon. There's no step. There's no chasing them. There's no sending them to the room. It's that quick. And if you can kind of stick with that for a couple of weeks and have all the caregivers do it, which is tough, the babysitter, the grandparents, then they usually don't. They usually phase out that behavior.
Well, we so often, you hear this idea of like children, it all starts at home, and it's so true. There's of course exceptions and unique challenges and circumstances that influence child development, but more often than not, if you spank, you might get a kid who hits. You yell at your kids, you're going to, foster that behavior, and your child's going to yell at others. And so I think it's really good for parents to think about that, of how their behavior, is a model for children. And of course, we all have room for improvement.
I want to challenge you. I think that's all well and good, but I have seen, especially in my special education practice, a real uptick in kids who just can't calm down.
Mm-hmm.
And we have been fighting for placements that were never thought of, such as wilderness therapy, never thought of in the elementary school ages. I think since COVID, the behaviors are getting much worse. I think parents are on edge. And I think all parents are doing what they can do. And I think in the past that might have been right, Kristina, but I'm going to challenge both of you on that. What do you do when you have a really out of control kid and you yourself are on your last piece of gas in your tank?
Right. Well, that was even where Kristina started out. The child who can't go to the restaurant, can't do play dates, having a hard time. I mean, that's definitely outside the normal realm. And then I think you really do need help. And I usually have people start with getting a pediatric psychologist involved. Sometimes even just to work with the parent and then coach the parent through how to manage things, or what is, a lot of times children with anxiety show up as being oppositional. They're stubborn beyond belief, but it turns out it's stemming from anxiety. and they're so afraid or frightened that they just don't want to do whatever it is. So if you are feeling that you're at the end of your rope, it's time to call out for help. So check with your pediatrician, try to get in with a child psychologist to help. And then sometimes they do need a special education situation like PEP, like the positive education program for I've had some patients there where the children couldn't handle themselves in a regular school setting, and they went into something like that and then did really well. But right, I mean, there certainly are some kids who are not managing with the typical advice. And so if the typical advice isn't working, that is often a sign that maybe there is something more going on.
Well, I think I want to do a shout out to our readers that I love what you said, Zizzy. If you feel that normal intervention is not working, don't blame yourself. Get help.
Right. Because probably there's something more going on with that kid when the regular advice. I did have one parent and she tried every last thing. And the kid was so bright that it took a while to diagnose. At first they thought it was anxiety, then they thought it was ADHD, but then it turned out it was autism as well. But the child is so bright that he kind of tricked everybody.
It seems so often it's really important for parents to listen to their gut instincts. And when being told, oh, your child is tired, moody, whatever, there's nothing wrong because she gets great grades. He's thriving on the standardized testing, but you feel like something is not right. Something is not right. It just, in our experience, it's so essential for parents to hold on to their gut instinct and keep digging and not settle or rest, even when there's schools or maybe even a pediatrician, people saying, no, it's fine. You're a hypersensitive helicopter parent, but those parenting instincts often serve us well.
Right. I 100% agree with that. My best teacher in residency told me that you can do all the blood tests and MRIs and everything, but basically listen to the parent, because if the parent has a concern, for the most part, your job is to really dig into that concern and figure out what's going on, because no parent really wants there to be a problem with their kid. So if they're saying that they're worried, usually there's something to it. Now, I mean, certainly there can be exceptions, and there can be some people that worry about things that are really fine, and reassurance. There's a role for reassurance, but I do agree. Parents most of the time really do have a great sense of their own kid.
So I have a really interesting question that we all sort of led down this path. And then with those high functioning autistic children, they're verbal early. They can really trick the system and they need early intervention. What would be the early signs to prepare us in that more high functioning level?
Oh, that's I mean, they're tricky. That may be a little bit past me, but I think it's again, maybe the social piece. Are they interacting with peers? Are they doing reciprocal play? Because the kids go from the parallel play around 2 to between 3 and 5. They do the communal play where they're pretending to cook together, or they're pretending to be on a boat and on a trip, and they're having to communicate with each other in order to play. And so if the kid really can't do that, and some kids on the spectrum want to do things their own way with their own script, and they only want to talk about a certain toy or movie or something like that, but won't listen to what the other kid wants to do. So I guess especially with a really verbal kid, but they're just not listening to the other kid. They're not taking the other kid's ideas and going with it. I think that could be one of the big red flags for the very intelligent, very verbal kid who turns out to be on the spectrum.
So, Kristina, why don't you launch our next topic?
No pun intended. So let's fast forward now. We've talked about the early years. Let's move down the line and talk about teenagers.
Okay.
High school students, perhaps college kids. Zizzy, I believe you've indicated that you listened to our episode with Dr. Mark McConville, author of Failure to Launch, who was such a pleasure to have on as a guest. And he's just so respected and knowledgeable and offered such good wisdom and insight and guidance. For those parents sort of wrestling with the issue, of how to foster independence and responsibility in their high school students, their teens, so that come time to head off to college in the fall, it's not a total disaster where the kid's sleeping in late, spending too much money, partying, and all of a sudden the straight A student is getting Fs. So what can parents do? What tips or strategies could you offer to help parents begin to foster those important skills of independence and responsibility very early on to avoid the failure to launch situation?
Yeah. And I did think that was a great episode. I highly recommend it for your listeners who haven't heard it. One thing that I sort of wish I had started a little earlier with my kids, so I'll say it for everybody else, but it is probably a good idea to start chores early on, like in the 3 to 5-year-old range. And it doesn't have to be something huge, but it could be, helping clean up toys, helping sort the laundry, set the table. They love to clean. So giving them a rag and stuff.
I love to clean.
Yeah. Yeah. And the Swiffers, and the little, even they make these funny little vacuum cleaners that kids can run that actually do pick up dirt, and they love.
Wow. That's
cool. So they like that. And then in elementary school, they can help take care of animals. They can help with the garbage. They can clean bathrooms. And then like in Montessori, the kids all make their own snack. And they can, with a knife that you get from takeout, like a plastic knife, they can cut cucumbers and they can help make a salad. They do like to help with meal prep. And then I have a lot of patients whose kids pack their lunch for school, and they have a little algorithm. You need a protein, you need a grain, you need a fruit and a veggie. And they have them kind of set up in the fridge in little zones in the fridge. And the kids pack their lunch and they fill each little section of their lunch. And they're starting with good nutrition, and they're starting with meal responsibility too. And then
out of like the whole notion of just the simple task of simple for an adult, packing a lunch, involving your school age child in that. There's so many lessons in there: executive function, planning, nutrition, all of it, just personal responsibility. That's a really great tip for
I've always had my children help with Friday night dinner. That was my big.
Yeah, that's another example that
Right.
they concept
Always.
really like that.
Right, like helping with cooking, so that then when they get older, they can be cooking some for themselves.
Well, my daughter, when she went to college, was shocked to learn that she was the only person who really could not only cook, but she's an excellent cook.
Right.
And I take for granted the time I spend with my children teaching them to be good cooks.
Yeah, so that's a good one. And then I'm also a huge advocate of parents getting out of the homework business. I really feel like starting in middle school, it should be between the child and the teacher, and it is not your job to know what the homework is and to check the homework and all of that, and let the teacher do it and let the teacher know what's happening before they get to high school, because the grades in middle school are so important. So if they mess up a few things, it's okay. But then they're in charge of their own homework. Now, I know it's easier said than done, and it's obviously easier with a more motivated kid. And if your kid isn't that motivated, you may have to be involved a little bit. But I would try to take some steps back in middle school with
I
regard
have
to
two
homework.
questions on that. One is, though, for my younger child, now if they go to school, there's an app and they alert you, and it's like, I turned it off. I don't want to know my daughter's not turning in her homework. I agree. But Kristina and I work with a lot of students, and sometimes we see it in adults who have serious executive function issues.
Right.
So what is normal? I forgot my homework. The dog ate my homework. And allowing them to have consequences versus seeing a child that might need some good intervention in their executive function skills. Now, I will say, and I want to know if you agree with this, again, it's not good to get involved because you want the teachers to see it and get the help and tease it out. But how do we know the difference between it just being, this is so boring versus I just can't get organized?
Yeah, I mean, I'm a huge fan of the family meeting, which I think one of your guests talk about that too.
That's a big part of positive discipline.
Right. Right. So the family meeting is a great one. And I was just reviewing some of the, recommendations for that. And this one thing I read said, the agenda should start with compliments, which is great because then everyone's looking all week for things that other people did well that they could list as their compliment, and then challenges. And then that's where you try to brainstorm some solutions. And that's where maybe this executive functioning thing could come in. So if there had been challenges with homework not getting turned in, or the books from school not making it home from school or whatever, that could be addressed at the meeting and talk about strategies to do better. But then if those methods are putting up something on the whiteboard in the kitchen, or, saying, would you like me to check that your backpack is loaded in at the night, kind of coming up with some dual strategies that the kids involved with, the parents involved with. And if those things aren't working, then I do think you need to get the school involved, the school counselor involved, to see if they feel like the child needs some more executive functioning support at school, or even is there an ADHD element going on that needs further diagnosis. So I am a big fan of that.
Might be a tricky question, but what's the difference between overparenting in your mind versus normal support for your child?
Great question.
Yeah, well, and that kind of gets back to this failure to launch thing. So let me actually go back to the failure to launch, and then we'll get back into that. So after the getting out of the homework business for high schoolers, I do think, like we said, they should be in charge of their work. And then I do think considering a paid job for your high schooler is not a bad idea, because paid work does teach a ton of responsibility and getting there on time and doing some maybe menial tasks that you don't really like to do, but you do them anyway. And then I did clothing allowance with my kids, and I thought it was fantastic. So they got a certain amount of money every quarter that was to be spent on clothes. And we had it all worked out. Like if I was going to buy like the winter coats and the boots or whatever, but this was just for regular clothes. And they got that amount of money, and they each had a bank account with a debit card, and I put the money in there. And then every time they went to the store, or nowadays, I'm sure kids are just buying it online, they could buy it or not, but they wouldn't get more money until the next quarter. And I think that's a great way to teach them. Like when your kids go to college, a lot of kids overspend, and then they don't, because they can DoorDash stuff, they can take an Uber, they have this and they have that. So like, it's kind of a nice way to sort of start teaching them that there is a set amount of money, and you can decide how you want to spend it, but there's not going to be any more for 3 months. Or you get your job and you make more money and you can spend it that way. So I do think some money management, one of my daughter's college freshman friends had no clue about money. And the parents were so mad because they were asking for more money all the time. They're like, what are you doing? How are you spending all this money? So I do think doing some money management in high school is a good idea before they get to college. But then back to your other question about the helicopter parent versus the supportive parent. I mean, obviously that's sort of a style point, and there are some cultural differences. But I guess I would say you'd like the kid to have some motivation on their own, that they're interested in something and they want to do it. And then maybe your job as the parent is to sort of provide a good place to do your work, or maybe we didn't talk about sleep, but I'm a huge sleep advocate. And I think parents should be pretty involved in when the kid goes to bed, because if they don't get enough sleep, then everything falls apart. And I mean, the amount of sleep children are supposed to get is much more than most kids are getting.
For adults.
And adults, exactly. And I was reading, you guys probably know Lisa D'Amour. She's an amazing local psychologist.
Yeah.
And she wrote a really neat article on sleep. And for the kind of the middle schoolers, she wants them all to get 10 hours of sleep, and said, you have to get your homework done. You need to do 30 minutes of chores, and you need 10 hours of sleep. And then if you have time for other activities, you can fit them in around that. But, the sleep is sort of the non-negotiable. So I think parents do need to be, and nowadays with teenagers, I get a lot of teenager checkups, and I ask them what time they go to the bed. And the mother said, well, I don't know, because I go to bed at 10 and I don't know what they're doing after 10.
I have to tell you, that is so true. When your kids are little, you have a tuck-in routine, but I will say goodnight and sort of check in on my high schooler. But I don't know what she's doing. I'm
Yeah.
hoping she's going to sleep, but I'm going to be more mindful of this. I just want to ask from a recent observation that I find so interesting. When I was 16, and Kristina chime in, getting your license was like the most important thing you could do. But I'm noticing from my friends and their kids in this generation, driving is not a big deal and they don't care if they drive. They're happy to Uber.
I agree. Growing up and when I was a teen, it was unthinkable that you wouldn't get your license the minute you possibly could. And it is this really interesting shift now. We're seeing a lot of teens who just don't think it's necessary because friends around them, or you have Uber, or driving is just too stressful, don't want it, don't need it. Have you seen that in your medical practice, or do you know what's fueling this, or what?
Yeah, what's going on? And should you just say, no, you're getting your license. This is not a choice because I am not your chauffeur.
Or do you have to really listen to what your child's expressing? I think the driving one, great question, Susan. That's a tough issue because you want to foster independence, but yet, it's like, well, if my kid doesn't want to drive, maybe I'm in a
Do I force them?
better eye on what's going on. And I think that's a complicated issue for parents.
Well,
Yeah.
put it out for us, Izzy. No, it's all a driving issue.
It is funny because I do think it does sort of depend on girl, boy. I mean, I tend to see that the girls are getting their licenses on time because they're just at that age, a little more organized. You have to do the thing and take the test and they just seem to be a little social and they want to get out and about. And so I tend to see the girls getting their licenses pretty close to 16 and the boys not being as concerned because, they can play their video games with their friends from their couch and they don't need to get over there because they're.
Go.
Yeah.
That's so true. Where are they going? They're staying home.
In terms of from a parent's perspective, if you need them to drive because you have other kids or you have other opportunities, then I think
job.
Yeah, like a job.
Or that.
that you could say, look, you're able to get your license. So it would, really make life easier. If you decide not to do it, then you're on your own to find your way to where your practice or wherever you're going. I think you can kind of try to put it on them a little bit. But I mean, honestly, teenagers are not the best drivers. So for me, waiting a little longer, a little more mature, a little more frontal lobe, that's fine with me. A kid who doesn't really want to drive.
A kid who doesn't want to drive.
I wouldn't push it because they can get distracted and it's a huge responsibility driving a car. And so I'd really want them to be motivated and know, that it's a big responsibility and they need to take it very seriously. I do tell kids around this time each year, sadly, there's often a carload of teenage boys that gets into a very serious, possibly even fatal accident. And usually,
we know.
Usually they're not drinking. They're usually just goofing around, just being funny, silly, goofy people. And it ends very badly. So I want them all paying attention while they're driving. And if they're not into it, I'd rather them in an Uber.
Yeah, that's really interesting. Well, Zizzy, I think we're going to have to invite you back. We did not even get halfway through what we wanted to talk to you back about. Wow, there's just so much stuff to talk to the pediatrician about.
There you go.
I think you need your own podcast.
Yeah, I will just put in one plug for my boss. I work for Senders Pediatrics, and my boss is Shelly Senders. Our website is amazing. And he writes, it used to be weekly, but now it's a twice monthly newsletter that has incredible topics. Like 2 weeks ago, we had TikTok brain on there and how to get more sleep. And this week's has some good information on what's going on with COVID. So if anyone has more general pediatric questions, take a look at our website. But it was great talking with you ladies.
We got to get together soon.
We're so pleased you're able to join us today, and our listeners check out Senders Pediatrics. Thanks to everyone for listening to Real Talk with Susan and Kristina. If you enjoyed this episode, please subscribe to our show so that you never miss an episode. and leave us a review so that other people can find the content we share as well. You can follow us on Instagram. Just search our handle @StoneSupler. And for more resources, visit us online at studentdefense.kjk.com. Thank you so much for being a part of our Real Talk community, and we will see you next time.